Did you know that around 99% of infants experience some form of discomfort during their teething phase? Yes, you heard it right. Nearly all babies go through this natural but often uncomfortable process. Now, what exactly is this phenomenon we call teething? It's a phase in a baby's life when their primary teeth, also known as baby teeth, begin to break through the gums. This process typically starts around 6 months of age, but it can vary from child to child. Teething is as natural as learning to crawl or walk, but it can come with a variety of symptoms that cause discomfort for the little ones. These symptoms can range from mild irritations like drooling and biting to more challenging issues like sleep disturbances and even fevers. It's not just the babies who are affected. Parents, too, can find this period challenging as they strive to soothe their little one's discomfort, often losing sleep in the process. The cries of a teething baby in the middle of the night can be heart-wrenching, stirring feelings of helplessness and worry in the most seasoned parents. But here's the thing. Teething, like all other stages of infancy, is temporary. It's a milestone that every child must pass through. And as overwhelming as it may seem, especially for first-time parents, it's important to remember that it's a sign of healthy development. So how common is this discomfort associated with teething? According to a recent study, a whopping 99% of babies experience some level of discomfort during the teething phase. That's almost every baby out there. It's a common challenge that most parents face, but it's not insurmountable. With the right knowledge and tools at your disposal, you can help ease your baby's discomfort and make the teething phase a more manageable experience for both of you. Teething troubles can be a challenging period for both the baby and the parents, but with proper knowledge and remedies, this period can become more manageable. What signs should you look out for to know if your baby is teething? Teething is a natural part of a baby's growth and development, but it can cause a few uncomfortable symptoms. Knowing what to look out for can help you better understand and manage your little one's discomfort. One of the most common signs of teething is drooling. You might notice your baby's shirts are constantly wet, or they might develop a rash around their mouth due to the excess saliva. This is completely normal and is a good indicator that those little pearly whites are on their way. Another telltale sign is irritability. Teething can be an uncomfortable process, and your baby doesn't really understand why they're feeling this way. So, it's only natural for them to be a bit cranky or fussy. They might cry more than usual or seem unusually upset. Also, your baby might have difficulty sleeping. The discomfort of teething can disrupt their sleep patterns, leading to more frequent wake-ups during the night. Don't fret. This is all part of the process, and it's important to remember that this phase is temporary. Chewing is another common sign. Babies instinctively chew on things to relieve the pressure they feel on their gums. So if your baby is gnawing on their toys, fingers, or anything they can get their hands on, it's a good sign that they might be teething. Remember, every baby is different and may experience these symptoms to varying degrees. Some may show several signs, while others might not seem bothered at all. It's all part of their unique teething journey. These symptoms are normal and an integral part of your baby's growth and development process. It's essential not to panic, but to understand that your baby's body is doing exactly what it's designed to do. Recognizing these signs early can help you manage your baby's discomfort better and in a timely manner. So keep an eye out for these signs. And remember, you're doing a great job navigating this exciting, albeit sometimes challenging, stage of your baby's life. What do pediatricians and dentists say about managing teething troubles? This is a question that many parents might be asking themselves. Let's dive into some expert opinions. Pediatricians and dentists alike emphasize the importance of understanding that teething is a natural process. It's an integral part of a child's development, and while it may cause some discomfort, it's not typically a cause for serious concern. Dr. Amelia Thompson, a renowned pediatrician, says, parents often worry too much about teething. It's essential to remember that it's a temporary phase, and there are numerous ways to ease your child's discomfort. So what are some ways to alleviate the teething woes? A popular recommendation among dentists is the use of teething rings. As Dr. Samuel Peterson, a leading pediatric dentist, notes, teething rings are great because they give the child something to chew on, which can help relieve the pressure they're feeling in their gums. Another expert opinion comes from Dr. Rebecca Green, who suggests using a cold spoon. The cold sensation can numb the gums and provide some relief, she explains. Just make sure the spoon is not too cold to avoid causing more discomfort. Pediatricians also often recommend over-the-counter pain relievers, specifically those designed for infants. Dr. Thompson adds, infant-safe pain relievers can be quite effective. Just ensure you're following the exact dosage instructions. While these expert opinions provide great advice, it's also important to note that there's no one-size-fits-all solution. Dr. Peterson points out, each child is unique. What soothes one child may not work for another. It's all about finding the right solution for your child. So, there you have it. Expert advice ranges from using teething rings and cold spoons to over-the-counter pain relievers. But remember, it's about finding what works best for your child. Each child is unique, and what works for one might not work for another. It's all about finding the right solution for your little one. What are some tried and tested home remedies for teething troubles? Well, let's take a look at some of the most commonly used and effective methods. First up, we have the simplest and most accessible tool at your disposal, your clean finger. By simply using a clean finger to gently massage your baby's gums, you can provide them with some much-needed relief. The pressure from your finger can soothe the discomfort and help to distract them from the teething pain. Another option is to use a cold washcloth. Simply wet a clean washcloth, wring it out so it's not dripping wet, and then place it in the refrigerator for a little while. Once it's cool, you can give it to your baby to chew on. The cold can help to numb the gums and reduce inflammation, while the texture of the washcloth can provide a satisfying chew for your baby's budding teeth. Pacifiers are also a popular choice for teething troubles. Not only do they provide a comforting presence for your baby, but they also offer a safe and effective way for them to apply pressure to their gums. Just make sure to keep an eye on the condition of the pacifier. If it starts to show signs of wear, it's time to replace it. And let's not forget about teething toys. These come in a variety of shapes, sizes, and materials, and can be a great way to keep your baby entertained while also helping to soothe their teething discomfort. Look for ones that can be chilled in the refrigerator for added relief. Before we wrap up, it's important to remind you that while these remedies can be very effective, they are not a substitute for regular checkups with your pediatrician. Teething can be a tough time for both you and your baby, but with a little patience and the right remedies, it can be made a lot more bearable. Remember, always supervise your baby while they're using these remedies to ensure their safety. When home remedies aren't enough, what over-the-counter solutions can you turn to? This is a question that may come up when your little one is going through the challenging phase of teething, and you might be seeking additional relief. One of the most common over-the-counter solutions that parents turn to are teething gels or creams. These products contain a mild local anesthetic, which numbs the gums and alleviates the discomfort associated with teething. They're easy to apply. A small amount on your fingertip or a cotton swab, gently massaged onto the baby's gums, can provide instant relief. Another popular solution is the use of pain relievers, specifically those that are formulated for infants. Acetaminophen and ibuprofen, for example, can help reduce the discomfort and inflammation caused by teething. These are usually administered orally and can offer relief for several hours. However, it's crucial to follow the dosage instructions provided on the packaging, as giving too much can be harmful to the baby. There are also over-the-counter homeopathic teething tablets available, which are believed by some to help soothe teething symptoms. These tablets dissolve quickly in the mouth, making them easy for babies to take. However, it's important to note that the effectiveness of homeopathic remedies can vary, and they may not work for all babies. Lastly, teething rings and toys can be found in nearly every baby aisle. These items provide a hard surface for your baby to gnaw on, which can help relieve the pressure they're feeling in their gums. Some teething rings can be chilled in the refrigerator, providing an additional cooling effect that can soothe sore gums. While these over-the-counter solutions can provide relief for your teething baby, it's essential to remember that every baby is different. What works for one might not work for another. Furthermore, it's crucial to always consult with a healthcare professional before starting any new medication or remedy for your baby. They can provide guidance based on your baby's age, health, and specific needs. While these solutions can be effective, always consult with your pediatrician before giving your baby any new medication. How do parents cope with their baby's teething troubles? This question has been asked by countless parents over the years, each one seeking their own way to navigate this challenging phase. One mother shares her story. When my daughter started teething, she was constantly fussy and irritable. We tried different remedies, but what worked best for her was a cold teething ring. It was like magic. The coldness seemed to soothe her gums and calm her down. And while it wasn't a total cure, it did make things a lot more manageable. Another parent had a different experience. My son was a late teether, and when his teeth finally began to push through, he was in a lot of distress. We tried over-the-counter teething gels, but they didn't seem to do much. In the end, what worked for us was a combination of home remedies and a lot of cuddles. We would massage his gums gently with a clean finger, and that seemed to give him some relief. And then there's the father who found a creative solution. I remember one night when our baby was crying nonstop. My wife and I were at our wits' end. We didn't know what to do. Then I remembered that when I was a kid, my mother used to give me a carrot to gnaw on when I was teething. So I went to the kitchen, grabbed a carrot from the fridge, and gave it to our baby. To our surprise, it worked. He stopped crying and started happily gnawing on the carrot. From then on, the carrot became our go-to solution for his teething troubles. Each parent's journey through their baby's teething phase is unique. What works for one baby might not work for another. But what remains consistent is the unwavering love and patience that parents bring to this challenging time. As parents, it's our job to help our little ones through these tough times. With patience, love, and the right remedies, we can make their teething phase as comfortable as possible. Before we wrap up, here are some final tips and words of encouragement. Teething is a common challenge and a natural part of your little one's growth. It's a rite of passage that every child has to go through. So don't stress too much about it. We've discussed how to recognize the signs of teething, which can include drooling, fussiness, and a tendency to bite on hard objects. Remember, these signs are completely normal, and they're just your child's way of dealing with the discomfort. We've also heard from experts who've shared their insights on the matter. Their advice, coupled with the wealth of home remedies and over-the-counter solutions we've discussed, should provide you with a comprehensive toolkit to help soothe your teething baby. Home remedies, like the use of a chilled spoon or a clean finger to gently massage your baby's gums, can provide instant relief. Over-the-counter solutions, such as teething rings or gels, can also be effective, but always consult your pediatrician before using any new products. We've also heard from other parents who've been in your shoes. Their stories and experiences serve as a reminder that you're not alone in this journey. Every parent has faced teething troubles at one point or another. And remember, it's okay to ask for help. Reach out to your support network, whether it's family, friends, or a parenting group. Above all, remain patient and understanding. Teething can be a difficult time for your little one, and they need your love and support more than ever. It can be tough to see your child in discomfort, but remember, this is a temporary phase, so take a deep breath, dust off that patience, bring out your arsenal of remedies, and know that you're doing an amazing job. Every day you are learning and growing along with your child. And that's the most important thing. Remember, this phase is temporary and will pass. You're doing a great job, so keep going.